Hi, this is Dr. Baxter from Shelby Pediatric Dentistry. We're so glad you guys are here. I just want to give you a brief introduction about tongue and lip ties. So what is a tongue tie? A tongue tie is an embryological remnant of tissue between the undersurface of the tongue and the floor of the mouth that restricts normal tongue movement. That's the official definition. They're classified according to attachment level, so what the appearance is, not necessarily how restrictive it is or how difficult it is for the baby to nurse. And really we need the symptoms from the infant and the mother, as well as the clinical presentation to truly diagnose it well. Breastfeeding issues, orthodontic problems, speech problems, airway issues are all things that can happen from a tongue tie. A lip tie is the failure of the upper lip to flange outward normally due to a restriction of the lip from an attachment of the lip inserting into the gingiva or the gums. That's referred to as the maxillary frenum, is what that's called, and so a frenectomy is removing that. The frenum is also the part under the tongue as well. It can cause the same difficulties and symptoms as a tongue tie, especially when nursing, and it can also lead to decay in young children and a gap formation between the teeth. There are many myths surrounding tongue and lip ties. These include that they don't exist, they don't cause problems, they don't cause speech problems, they don't cause nursing problems, they will stretch or the child will fall and rip the lip tie eventually. Should wait until after braces in order to fix the lip tie. Other myths could be a quick snip with scissors will fix the problem. If we hear a quick snip or clipping, it may not have been done fully, a full release. Typically, it's just the first few millimeters of the tongue tie, but they didn't go deeper or further back as would need to be done. And the last one is that a child will need general anesthesia or sedation to treat. So we go to the hospital and sometimes we see kids there that are 6 months old being put to sleep just for a frenectomy. And so we will never do that in our office because we know that we can do it safely and effectively on the child, under a year old with no sedation, no general anesthesia. These are also, babies that are having difficulties with nursing that aren't resolving. So they're not gaining weight. It's painful for the mother. The child has reflux and thrush and has been swallowing lots of air, making clicking noises, all those kinds of things, with intensive lactation support, they still aren't getting better, then those are the kind of babies that we want to look at as maybe having a tongue tie or lip tie. Nursing is also nature's palatal expander, so it helps expand the palate from a V-shaped to a U-shaped, and just having the tongue free can also help make that U-shaped palate because it rests up in the palate. It can also lead to sleep apnea in kids and adults. They're studying the connection right now. It's not fully fleshed out, but there's definitely a connection. Difficulty swallowing foods, so when they're transitioning to solid foods, it can be difficult for the child sometimes. That can be a sign of a tongue tie. Definitely speech issues in the future like L's, S's, SH, TH sounds. And dental issues in the future. So a lip tie can cause a diastema or gap between the front teeth, or it's like a narrow palate leading to crowding. So the main problems related to tongue and lip tie for babies is an inadequate latch, not transferring enough milk, failure to gain weight, and failure to thrive, short sleeping, needing frequent feeding. If the baby falls asleep while attempting to nurse, they're just using so much energy, not efficient at all. Nursing, reflux, thrush, colic, all those things can happen too. The baby's just spitting up all the time, a real fussy baby, snoring, heavy breathing, congestion in their nose from the milk going back up in their nose, or choking on the milk can also be related to tongue tie. Other symptoms, the baby's gumming or chewing the nipple, that's because the tongue doesn't cover the gum pad, and so the baby's reflex automatically is to bite down if there's something in the mouth and the tongue is not over the gums. And that can lead to bleeding, blistered, cracked, or creased nipples, severe, even moderate pain when latching, poor incomplete breast drainage, the baby's not getting all the milk out, infected nipples, mastitis, or thrush, and all that leads to feelings of depression. It's just been so difficult on the mother and the baby. So our story with our girls, we had twin girls, they're now 2 years old, and they had difficulty nursing and couldn't latch or transfer milk effectively. It was just more than a full-time job to feed them. We could get them to latch on and off with our lactation consultant's help, but we still didn't have great milk transfer. It was very difficult to feed at all without the lactation consultant there. So my wife was pumping as well as trying to nurse, and we were finger feeding and syringe feeding. There's the syringe, there's the finger feeding. Still a struggle. Our pediatrician said, she can clip with scissors. We tried that, and it didn't have any difference. So we thought, okay, that's not the problem. We went on another several weeks until they're finally 4 weeks old, and our lactation consultant said, we really need to get that tongue fixed by this dentist who does a great job with the laser. So we went out there and got Hannah's done. That's what she looked like with the little laser safety glasses on, all swaddled up. And you can see under there her tongue is kind of cupped up, and you can see there's a small little white line under the tongue. That's from where the scissors was, this little scar. And Noelle, her other daughter, that's from about 24 hours after she was born. But her tongue is held down and it's not sticking out at all, not lifting up when she yawns. So they both had tongue and lip tie issues. We had theirs fixed by the dentist, and the rest is history. It was so much better afterward, a better latch, and Hannah's reflux got better. This is the proper examination technique for how to examine a baby for tongue and lip tie. The child's head should be in the provider's lap or in a dental chair with the doctor in the 12 o'clock position. This allows the provider and the mother to have a clear view of the lip and the tongue. This also allows for an accurate assessment of function and any restrictions. If the child is examined in the mother's arms or in the infant carrier, it's going to be very difficult to diagnose a tongue tie or lip tie properly, especially a posterior tongue tie, and they'll often go missed. These are the advantages of using a laser for these procedures. So there's minimal to no bleeding. Typically there's not much at all. It's less painful than scissors or a scalpel because you're not cutting through the nerve endings. You're instead vaporizing them so they just disappear. And the child, doesn't experience much pain from it during, the several hours after the procedure. There's better control and visual field during surgery, so we can see what we're doing a lot better, get a very precise release of the tongue or the lip. There's no need for general anesthesia or sedation. Typically, in a toddler, again, we may use sedation, but in babies, we've never used general anesthesia or sedation and never will. Very effective, so it works. We see great results from it. It's not a guarantee, but we do see excellent results from using the laser for these procedures. And there's also excellent healing. Heals up very nicely. It takes about 3 weeks for the tongue to heal, maybe 2 weeks for the lip to heal, but it looks a lot better even at 7 days. And there's very minimal scarring. Afterward, you can't even hardly tell where we did the procedure. There may be a small white patch, but even then, it's very, very minor. So this is a team effort. We can do only one part, but for successful nursing, there are other professionals that need to be involved. A lactation consultant is critical to follow up with a baby who has been having difficulty nursing. So there's online support groups that can be helpful, but really there's nothing that beats having someone that can help you with positioning, that can give you advice. That's really a great resource to have, and it's very, very important to follow up with them within a day or so after the procedure and continue to get as much help as you need. A physical therapist or chiropractor can also be helpful if your baby has any issues like torticollis from birth trauma. There can be tight neck muscles, etc. Pediatrician is also critical to follow up with for just routine visits, and also get their weight checked. You make sure they're gaining weight appropriately. That's the biggest indicator for these new babies, is if they're nursing well, if they're gaining weight well. So in the healing phase, we want mom to nurse right away in the office, and you should notice an immediate difference. Hopefully, not always, but oral wound healing is rapid. It can look like an infection or pus, but it's not an infection or pus. It's just what the scab looks like in the mouth. And there's a picture of that on the next slide. Sometimes it's been reported the baby may drool more. You can give Tylenol and Motrin. Motrin's only if they're over 6 months old for pain. It's dosed by weight. For other age babies, you can do suppositories if needed. Feverol, just check the dosage on it. There's some homeopathic remedies. You can find these online possibly. Warm bath, skin to skin, just holding the baby on your chest with just a diaper on. Soothing music, all these things can really help the babies without the need of other medicines. Breast milk ice chips can be helpful, so take some frozen breast milk, break up little pieces of it, give it to the baby. You can also make breast milk popsicles with a piece of terry cloth and a rubber band and dip it in the breast milk, freeze that, and then let the baby suck on it. Ideally, we'd have them nursing, not bottles, but if they're not eating, you need to use bottles. Don't just let the baby get dehydrated. Nursing shield, sure, that's okay at first if it's needed, but ideally you get off the shield after a few days or with working with your lactation professional. Typically it's painful for the baby. For 1 to 3 days it's sore. You should see some really good improvement by the 5th day. If they're going to have a nursing strike at all, it might only be a day or so. Call our office if you're concerned with anything though. Here's some photos of what it looks like when it's healing. It's a little white, yellowish area. That's just what a scab looks like in the mouth. And if you see under the tongue on the picture on the right, there's a little bit of red stuff there. That's a little bit of blood from where we did the stretch and kind of broke the adhesion a little bit. So that's what you have to do at home. Lift it up, make sure it can open all the way. You see that full diamond, otherwise it'll be healing back together, and then it'll start hurting again when you're nursing, or it can cause problems. The baby won't transfer milk as well, and then we may have to repeat the surgery, which we definitely don't want to do. So there's a kind of physical therapy, exercise part afterward. Tylenol and Motrin is recommended. The Tylenol, if you give it every 4 to 6 hours as needed, most babies who are seeing 6 to 11 pounds would be 40 milligrams or 1.25 mLs. The 12 to 17 pound babies, 80 milligrams, 2.5 mLs. You can see from there how much the baby weighs if they're older. Infants Motrin, again, only over 6 months old and over 12 pounds, but that's 50 milligrams and 1.25 mLs. During the procedure, we follow all laser safety protocols, use protective eyewear for everyone in the room, including the child. It's very important. We swaddle the infant to prevent movement that can make the procedure more difficult. We often recommend parents wait in the nursing room or in the lobby during the procedure so we can focus 100% on the baby. The procedure takes about 20 seconds for the lip and 20 seconds for the tongue, another couple minutes to set up and position the baby. And we'll bring your baby to you right away in the nursing room as soon as we are finished. Here's a few pictures of what you'll see right in before and after the procedure. So these were taken all in our office. The top left picture is of a baby with a lip tie. You can see it does not elevate to the nose. In the second picture on the top left, the nose is now covered fully by the upper lip. You can see a nice diamond shape there. So the baby is able to flange their lip better for nursing. Keep going right. There's an anterior tongue tie. That tongue is tied all the way down to the tip. Afterward, the tongue elevates all the way up. You can see a nice diamond shape under there. That's the diamond we want to maintain with the stretches. In the bottom series, there's a baby with a really thick lip tie, preventing the lip from flanging outward. You can see afterward, it flanges up nicely. This will also help prevent a gap in the baby teeth and the permanent teeth. That's how thick that lip was. If you keep going right, there's another picture. That's a posterior tongue tie. So this one doesn't look as bad as the one on top, but it causes the same nursing problems. This is a posterior tie. It can only be seen if you lift up on it. It's often missed by other healthcare professionals. And then going to the far right, there's a small diamond underneath, just a small release. That's all it takes. But these ones are more likely to heal back together. So if your baby has a posterior tie, be really diligent with the stretches because it can heal back together and start being painful again at about day 7 or 10. So for post-frenectomy exercises, these are done to prevent reattachment and strengthen the tongue muscles. Done 3 weeks, 6 times a day. Typically you want to nurse on one side or give some milk with the bottle, do the exercises, and then nurse on the other side. Really want to keep it as playful as possible, make funny noises, beep, bop, boop, boop, beep, stuff like that, and play with the mouth and the tongue so the baby knows that every time you're going into their mouth, it's not going to be a terrible experience for them or going to hurt. Keep the actual stretching of the wound to just a few seconds. You can also kind of massage the gums, massage the tongue, get them to move their tongue and play with their tongue. Use a camping headlight. You can get one at Walmart for very inexpensive, or have someone hold a flashlight. Wash your hands before doing the exercises. You don't have to use gloves. You can if you want to, but typically if you just wash your hands and get with some soap, they'll be clean enough and they'll be fine. First, lift the upper lip so the diamond is opened up. You want to see the whole diamond, and then use a gentle massage right on the wound, again, just for a few seconds. And then coming from behind, use 2 index fingers to elevate the tongue. So lay the baby down on the couch or on a pillow or on the bed, and then come from behind, use 2 index fingers, lift it up, and elevate the tongue. Almost push the tongue towards the back of the mouth. You want to see the whole diamond-shaped wound with your flashlight, and then gently press on the wound. If you see it's healing back together, we may have to do a deeper stretch. Just, again, the same rolling massage motion. Reattachment is the phenomenon where the wound heals back together and it starts causing nursing pain again, where the baby's reflux comes back after a period that it's been better. So it might be better for 3, 4, or 5 days, and then at day 7, it's getting hard again. It's a gradual process, but it gets hard again. It's because it's sticking back together. And so, this can happen if the stretches aren't performed, but even if the stretches are performed well, it can still happen. So don't feel bad. But if you make sure to stretch every 4 to 6 hours, look at the site with the light, that'll minimize the chances of reattaching. If it looks or feels tight, you can do a stronger or deeper stretch to kind of break the adhesion. You're basically opening the scab back up. And it will bleed a little bit. If you want to come to our office, we can help assess it. If you're having pain about day 7, definitely make a follow-up appointment. Come back and see us. It's part of the natural healing process, though. So your baby's body's just doing what it's supposed to do. If I cut my hand open, the wound will stay open, and then it closes together gradually over time. But what we're trying to do is just keep that wound open all the time so it does not heal back together. So for follow-up, I will call later that night to check on you and your baby. So if you see a random number around 5 o'clock, it's me calling. So if you have any questions, please let me know when I call, or please let me know before the procedure. You can also call the office beforehand, before 5 o'clock if there's any issues that come up. Please see your lactation consultant within 24 hours, ideally. If it's on the weekend, then the next business day. Continue to see them on a regular basis until good sucking skills have been established and nursing is effortless. It's not painful, the baby is doing well, keep following up with them. If you don't have a lactation consultant, please let us know. We can help you find one. Remember, it's a process, so it will likely be better in the office, that first feed, and then it might get more difficult for a day or two as the baby realizes that something's happened with them and they're sucking differently, and it doesn't feel like it always felt their whole life. Might get progressively better over a few weeks, might get more difficult at about a week. If that happens, if it gets better and then gets harder again, come back and see us. It could be reattaching. Sometimes babies have other issues that may need to be resolved by a physical therapist or a chiropractor, like torticollis that can happen with birth trauma. There's also a Facebook group I'll make you aware of. It's called the Alabama Tongue and Lip Tie Support Group. People can get on there. You can share with other moms your story, and you can give each other encouragement, and they can help answer questions as well.